Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Robert J. Havey, MD, Institute for Global Health, and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions as well as addressing the latest COVID headlines through today, the 11th of January. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion again today is Sophie Piskowski, who is our student research assistant with the Institute. So Sophie, I now turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy. Well, now for some updated COVID statistics. In the United States yesterday, there were 1.4 million new COVID cases in just one day. Hospitalizations have increased by 82%, deaths have increased by 36%, and we're still seeing a vaccination rate of under 63%. This number is not increasing. In Illinois, we had 77,478 new COVID cases with a death rate of 31%. In Illinois, we're seeing about a 64% of the population fully vaccinated. A lot of these numbers are rather depressing. Dr. Murphy, what can you tell us about, these spikes, 1.4 million cases yesterday in the United States and globally?
Let's make this perfectly clear. This is horrible. This is a national disgrace. It's a crisis. We're not even at the peak. And we've just shattered worldwide records with the number of cases. And first you have the infection, you have the cases. Then you get a proportion of those people end up in the hospital. So you have the hospital rate goes up. And so that, as you've just mentioned, increasing tremendously. In Muskegon, Michigan, which is some 130 miles north of Chicago on Lake Michigan on the western shore of the state of Michigan. The hospital is so full and there's no place to transfer any patients. They actually have patients outside in a tent. Now, in 12-degree Fahrenheit weather with snow and everything, in a tent in the United States, what is happening? What's happening is it's a failure not of any one person, not of any one agency. It's not the CDC's fault. It's not the White House's fault. It's not the NIH's fault. It's the structure of public health that's being stressed out by a pandemic. The structure is just not set up correctly. I mean, it's just not set up optimally. I don't know what the correct system is, but what we have is not working. We have 50 states, 6 territories with people in it. They all have different rules. They all have some anti-public health rules, some have pro-public health rules, whatever. But whatever it is, it's not consistent and it doesn't work. And the central authorities really don't have much power to put public health mitigations into some kind of enforce. They really have very limited enforcement of these. And we've got a population that has lost faith in the leadership, and they're blaming it on the leadership. But it's really more the structure of things and not any particular person. And it just shows you that the virus doesn't care. The virus doesn't have a brain, all right? So the virus just gets out there and it is just ripping through the population. Now, this spike is going to come to a peak and it will go down, just like it's done in South Africa and starting in some European countries now where it's leveling off, and then it'll drop again. It'll go down. But the only thing that's, well, there are many things that are going to help that. And of course, promote the vaccinations, especially with the boosters, avoid gatherings of mixture of vaccinated and unvaccinated people. but unfortunately, this includes schools. If we can mandate vaccines in certain workplaces, like United Airlines has done, and Google and Facebook, all the other, a lot of big tech companies have done this, and improve our ventilation for the indoors, especially in the northern part of the United States, where we're going to be indoors for a couple of months every year because of the winter. If we don't do all that and improve the masks and get people to wear them consistently, this thing is, we'll just wait for the next wave to come. So that's basically what's happening. Not a very good public health grade today, I'm afraid.
No, absolutely. And a headline that ties right into that is, what are some 5 reasons, Dr. Murphy, that you should not deliberately catch COVID? Can you tell us these 5 reasons, please?
Yeah, there's this like wildfire, this idea going around that COVID's not so bad, that we should just all go try to get COVID to get it over with and get more immunity. It's amazing how many people have bought into this argument in such a short period of time. And it's really across the whole spectrum of the population, not limited to any one group anymore. It includes even vaccinated people who are otherwise intelligent. I don't know where this information is coming from. But anyway, so a few experts, including myself, have talked with some reporters about this on CNN, the written CNN today, this morning. There were 5 reasons that the group of us came up with independently. We're not in communication with each other or anything like that. But it includes 5 reasons why you don't want to go try to get Omicron, all right? Number 1, it's not a bad cold. It's a life-threatening disease. It causes long-term complications in a significant portion of people. And regardless of your age and underlying diseases, it can land you in the hospital and even kill you. This is a life-threatening situation. If you have any kind of underlying diseases, it's even worse. It's much more likely to have a serious consequence. So it's not a bad cold. You can get long COVID. We don't even know the rate of long COVID with Omicron, because Omicron's only been around for 2 months. And long COVID is really what's happening to you at 6 months, 3 or 6 months, pick whatever long period after you've recovered. So not everybody just recovers and goes back to their normal life. Many people have complications after, and they can be quite serious. So long COVID. Number 3 is, if you increase the number of people even more than the 1.35 million people that got infected yesterday, you're just fueling the epidemic even more. You're helping to spread it to unvaccinated children, immunocompromised people, unvaccinated people for whatever reason. You're just going to fuel the epidemic. It's like throwing, here, take a little kerosene on the fire. That's not good. Because what that will do is, the 4th thing, you're going to stress out the healthcare system even more. You may be an otherwise healthy person that has a limited disease and do well. However, you could spread it to somebody. You could give it to your grandmother, your mother, some elderly relative, or somebody with some underlying heart disease, or just some genetically unlucky person that can't handle this thing. They're going to end up in the hospital. And the hospitals are full. They're at capacity in many parts of the country, and the ICUs are filling up. Fortunately, because of the first round, there is no real ventilator shortage. We've got plenty of ventilators, but we don't have the places to put them. And the staff at the hospital, a lot of them are getting burned out. They're leaving. Or they're getting sick and getting out of the workplace. So that's putting the stress on the system even more. So the stress of the healthcare system, and then that will affect everybody. If you have a heart attack, you're in a car crash, you break your leg or everything, the hospital's just loaded with COVID patients. They're not going to be able to take care of you that well. People are getting shunted, they're avoiding non-essential surgeries, non-urgent care. And all that has a price to pay. down the road. And you look last year, there was an increase in heart disease deaths, cancer deaths, stroke deaths, Alzheimer's deaths, because people weren't taking care of themselves because the hospitals were everyone was all clogged up with all this COVID. So that's not good. The healthcare system's stressed out. And then the final thing, which was not my recommendation, but one of the other people, is don't mess with Mother Nature. Don't try to like get infected with a pathogen, that's more of a theoretical kind of statement, but those are the 5 reasons that were given, and it's actually getting a lot of play right now.
That's awesome. And speaking of a lot of the record numbers that you were mentioning, there was a record number of hospitalizations due to COVID on Monday in the United States. Can you tell us a little bit about this number compared to what we saw exactly a year ago?
Well, it's 132,646. Last year was 132,051. So there's like 500 some more people. We're at capacity, very close to capacity. I don't know if you remember at the beginning of this thing here in Chicago, when they saw the numbers going up like this in the crisis that was happening in New York at the time. But they actually turned McCormick Place, which was empty because there's no shows going on because everything's locked down, into this giant 1,500 bed hospital that ended up, by the time they got it all put together, that peak went down. And so they had this giant 1,500 bed hospital. Thank you, Army Corps of Engineers. They did a great job. But then there was no patients. And then we got below the capacity in the hospitals. But it was a safe thing to do because we don't know, we couldn't predict. And so, it was just an insurance thing and it didn't work. But now we have all these ventilators and stuff, so that's great. But, if the next variant is even worse than Omicron, we're going to have to rethink some major field type hospital situations. I mean, we can't put people out in a tent. Now, granted, it's got to be heated, but still 12 degrees. The winter in the upper Midwest, in the northern part of the United States, is pretty cold. We can't do this. This is not sustainable.
Yeah, no, definitely. Our next headline is early data hints at Omicron potential toll across America. You've been touching on this quite a bit, but what can we see with the death rate that's following the number of cases? Yeah,
the percentage death rate and the percentage hospitalization rate is lower. So it's a milder disease that was first noted in South Africa, where they said, hey, there's no big bump in the hospital rate and stuff. I remember the South African population is very different from the US. It's a very young population. They were able to handle the disease better. Our population is much older, like in Europe. But we are seeing less compared to Delta in particular, less hospitalization and less death, but more cases. And since there's more cases, that still means the number goes higher than it was before. So we shouldn't be sitting on our laurels and relaxing, oh, it's a less serious disease, but if 3 times as many people get it, then there's more disease. So that's why the healthcare system is stressed out right now.
Yeah, definitely. And now for our last big COVID headline is flight disruptions continue as Omicron depletes staff. What can you tell us about travel going on in the United States and globally?
Well, the airlines were just getting back to some kind of normalcy in their flights, mostly domestic. International travel is still way, way off. And international travel is highly profitable. The domestic travel is much more competitive, and it's a different animal, so to speak. So, and that was really what was flying, was the domestic travel for the most part. And they can't keep enough people, not only the crew, don't forget, there's, reservations people, there's back office people, there's mechanics, there's the people that deliver the food on the plane, and, fueling, and, running an airline, like, it's really super complicated. And you have to have all those parts adequately staffed, because you've got to be, you're up in the air in a tin cylinder, not tin, but metal cylinder, and everything has got to be working perfectly. You want, safety is really key. So if something is not safe, that plane is not going to go, and that's why travel by air is so safe, much safer than in a car or bus or even a train. So the airlines, they've got to, if they don't have the crews, and they don't have, it's not just the crew, but if they don't have the people to keep everything safe and going, they're gonna cancel flights. So that's going to be very disruptive as well, and that's not going to help. And just cutting the isolation days down to 5 from 10, and no quarantine for vaccinated, and quarantine for only 5 days, and no testing, all these things to loosen things up. I think this is say A is sending a bad message, but B is it's not gonna help. It's gonna help minusculely. All right. People will recover from this. Let them recover and let them come back to work safely. And but until we get the peak down, this is not going to end. You can cut the isolation another day if you want. It's not going to make any difference, or the difference is not even going to be measurable.
Right. No, exactly. Well, those are all of our COVID headlines. Now for some questions. Our first question, are there any new statistics regarding the link between people getting the vaccine and the booster and developing blood clots? This individual had his booster in early December and then proceeded to have a stroke in January. What can you tell us a little bit about vaccines and boosters and blood clots developing?
Well, we don't know what vaccine this person had. So we're just kind of playing a guessing game here. The vaccine that is associated with blood clots is the Johnson & Johnson vaccine and the AstraZeneca vaccine, which is not approved here, but is widely used across Europe and many parts of the world. So the Johnson & Johnson vaccine would be out. The blood clots from the other vaccines would be very unusual. Regardless, a person could file a VAERS report, VAERS, from the FDA. They can report that they had the stroke so many weeks afterwards. I think that's probably a good idea in any kind of unusual situation like this, so that we can gather that information. I have filed a case very similar to this in one of my patients who had a little stroke afterwards. And I was followed up by the FDA, and they asked more questions. What was the lot number of the vaccine? How did the patient do? I mean, there was an interaction there. They were interested in that kind of side effect. So you could do that. But back to the blood, COVID also causes blood clots, is associated with blood clots. So we've got to be very careful. I mean, not to just throw out vaccines, because even if one person has a blood clot related event, because if they got COVID, the same thing could happen. I have a patient in the hospital right now with blood clots from COVID, not the vaccine. Anyway, keep in mind that the blood clots, although they can occur in men too, and whatever, it's predominantly in women less than 50 with the J&J vaccine. So I would say that's not a vaccine that a younger woman should take. And in men over 50, they tend to have neurologic events. Maybe this is what's going on here. I don't know. But so it's men over 50 and women under 50 have a little bit more events. Still, it's a really small part of the whole group that's getting that vaccine. But these type of events are not commonly reported with the Moderna or the Pfizer vaccine.
Well, now for our second question. Another similar situation. This individual is 44 years old with arthritis, and they received the Pfizer vaccine and the Pfizer booster. After their shot, their arthritis medication stopped working and had a severe inflammation, and they have been on 3 different medications now in the last year. Makes them concerned about the future, vaccines, and if they will need another booster, etc. What do you recommend them getting in the future, since they had such a reaction to the Pfizer vaccine?
Well, COVID would still be bad for this person. I would recommend the Moderna vaccine in particular at that 50 microgram dose, because getting COVID is going to be worse for them. And the Arthritis Foundation in the United States has got a whole bunch of resources and has looked at this very closely, and I would contact them as well. I think I think they could be very helpful.
Wonderful. Now for our third question. This 12-year-old had both doses of Pfizer and she just tested positive for COVID in late December and has had mild symptoms. They'd like to know when she should get the booster since it has now been approved for her age group.
Yeah, so the boosters are recommended regardless when you had COVID. It's really 5 months after your second shot. So you have the first shot, then 3 weeks later you have for the Pfizer one, this is Pfizer one, and then it's 6 months after that, as long as you're not sick at that particular time, and you're feeling well, and you're 6 months from that. So that's when the booster should be given. Doesn't matter when you have COVID. Yeah.
Wonderful. Now for a pretty typical issue, if two people in the same household are positive, do they need to mask and isolate from each other?
Nope. You can do anything you want. All the COVID people can be in the same room. It really won't make any difference.
Wonderful. And now for our final and last question. This individual's son is 3 years old and attends preschool twice a week. They have an older child who is in grade school and is vaccinated and is also wearing an N95 in school. But is preschool safe for the 3-year-old? These young children don't have a concept of social distancing and wearing masks correctly between breaks and snacks, etc. The masks do come off. What can you tell us a little bit about preschool and safety for children who are not able to get the vaccine yet?
Well, this is a very tough question because you have to balance out, many social factors. If the parents have essential jobs, have to work, cannot work at home, or they can't get someone to watch the kid or something, you may not have an option. And the preschools are trying very hard, vaccinating the workers and trying to do all the appropriate things. So if you have to do it, you have to do it. If it's an option, I agree with really where this question is going and what this person thinks. Maybe take a break. We're at the peak of this thing. There are more cases now than ever in the whole 2+ years of this pandemic. Take a break. Anytime you can avoid mixing vaccinated and unvaccinated people, whether it's a kid under 5 years of age or just somebody that doesn't want to take the vaccine or can't take the vaccine, you want to avoid that right now because there is just so much infection out there and the Omicron is so contagious. So if she has the luxury of keeping the kid at home for a couple weeks or a couple months, I think that would be the safest and would be the best bet.
Wonderful. Thank you, Dr. Murphy. Those were all of our COVID questions for today.
Great. Thanks, Sophie.